Bluffton Jasper County Volunteers in Medicine wanted to get a head start on a national program designed to figure out the best ways to map patient outcomes in several key areas, to make sure its patients didn't just seem to be getting healthier, but to verify they actually are. 3 years ago, Blue Cross Blue Shield asked South Carolina Free Clinic Association members to be part of the National Roadmap to Health Equity, which is a program sponsored by AmeriCares. And in 2024 and 2025, with the generous guidance and help from Blue Cross Blue Shield, BJVIM has been able to track 70 random patients in 3 key areas: A1Cs, high blood pressure, and mammograms.
I think when we found out that Blue Cross Blue Shield wanted us to incorporate this roadmap to health equity into our clinic, that we were really very intimidated by it. We were concerned because we didn't know whether we were able to pull these random patients. Then when we got the random patients, we didn't know what we were going to do with them. And then when we got the results, we didn't know how we were going to take care of them.
BJVIM sent the information it gathered into AmeriCares to see how they compared with other local, state, and national free clinic nonprofits. And Pam Toney says the results are exciting. They show that BJVIM is doing a good job getting and keeping their patients healthy. In 2026, it is mandatory for South Carolina Free Clinic Association members to be part of this Roadmap to Health Equity program.
By incorporating our podiatrist and our cardiologist and our pharmacist and our nurses and our medical directors, I think it's just made the program so much more successful. And now when in 2026, when we must incorporate this into the program, it'll be no big deal because we've already done it.
In 2025, volunteer and retired nurse Terry Rowe and colleagues improved on the program by using the information they had gathered in 2024.
Once we had our 70 patients that we audited, I went a little bit further and looked at their charts and see what they had. Are they missing having their podiatry appointment? Have they seen the eye doctor in a year? So once we did that, we put them all on a spreadsheet, and then we looked at them on every time they came in to see the physician.
Bluffton Jasper County Volunteers in Medicine nurse Lori Andrews is also a diabetic educator, so she and Terry are holding classes for their diabetic patients.
I would like everyone to feel more comfortable with Volunteers in Medicine and just have a closer relationship with us, and so they can feel comfortable calling on us.
Just last week, I saw one of the patients that did come back, and she got very excited about it. She's lost 5 pounds. Her A1C has come down. She says she does feel better, and she said she did benefit from the classes. So it's nice to see that what we're doing is working.
It's wonderful to be in this position, to feel like you're making a difference, and I really enjoy the patients here. They are just really special people.
BJVIM is also holding nutrition classes and offering chair yoga. Patients are so appreciative of all the attention on their health. Sharon Howe is a diabetic and has multiple sclerosis. When her husband lost his job, they lost their health insurance. BJVIM is doing more than she ever expected to fill the gap.
I think it's amazing. And it's helping me. I mean, granted, I've grown up, both my mom and dad and my dad's mother and my mom's mother were diabetics, but I need all the education I can get because things change.
Tony says the program has also taught her that the more she involves her staff and the patients, the more invested everyone is.